When policy enters the living room, it becomes personal. This story explores how immigration policy and political climate impact one family's daily life. Across New York City, nearly 3 million immigrants make up over one-third of the population and contribute billions to the economy. Yet behind these numbers are real families navigating fear, uncertainty, and resilience every day. Meet KS, a 36-year-old Puerto Rican mother of three living in Newburgh, New York. She is married to a Guatemalan immigrant who came to the United States as a child after experiencing violence in his home country. Together, they have built a life centered on family, work, and hope, but increasingly shaped by fear and instability tied to immigration policies. In her interview, KS shares, "We've been together since I was 19. For years, immigration status was not a central concern. Like many families, they focused on raising children and working towards stability. But in recent years, shifting political rhetoric and enforcement have made their future feel uncertain, turning what once felt stable into something fragile. In communities like Newburgh, where immigrant populations are significant, daily life has shifted. KS describes becoming more cautious and withdrawn. These changes reflect broader realities, like immigrant communities often facing structural barriers such as economic instability, limited access to services, and fear tied to enforcement. "I don't want any reason for the police to pull me over," KS explains in her interview. She has stopped playing Spanish music in her car and removed cultural symbols out of fear. This reflects how fear reshapes identity expression, safety, and belonging, especially in environments where discrimination and surveillance feel very possible and real. KS fears her husband could be detained by immigration enforcement despite being a hardworking provider. This fear is not isolated, as many immigrant families experience anxiety due to enforcement policies. Even in places with sanctuary protections, fear persists, limiting trust in systems meant to provide safety. The impact even extends to the next generation. KS's daughter participated in a school walkout protesting immigration enforcement. Children in immigrant families often carry emotional burdens, including fear of separation. Research shows that this kind of toxic stress can negatively affect both mental and physical health outcomes. KS envisioned a traditional wedding, but instead, the couple married quickly at a courthouse to begin the immigration process. Financial resources are directed toward legal fees and international travel requirements, delaying goals like homeownership. Immigration policy doesn't just shape status, it reshapes life milestones. KS describes ongoing anxiety, depression, and isolation. She tracks her husband's location and monitors immigration activity in her community for safety. Structural barriers such as fear of deportation, discrimination, and mistrust of institutions often prevent families from accessing services even when they are eligible. Despite these challenges, KS shows resilience. She practices meditation, exercises at home, and relies on trusted relationships. However, many immigrants avoid healthcare or services due to fear, which is a phenomenon known as the chilling effect, which can worsen health outcomes over time. Like many families, KS and her husband share a simple dream: to raise their children, own a home, and grow old together. Yet uncertainty about immigration status leaves them questioning whether that future will take place in the United States or elsewhere. In her interview, KS emphasizes Latinos are not criminals. Immigrants contribute significantly to society. Nearly half of New York City's healthcare workforce is made up of immigrants. Still, harmful stereotypes and discrimination continue to shape public perception and policy. KS's central question remains: what happens to family like ours? Her story highlights the gap between policy and lived experience. While programs like New York City Care and sanctuary laws aim to support immigrant communities, fear and barriers still persist in everyday life. Advocacy is essential. Organizations like the New York Immigration Coalition and Make the Road New York work to expand healthcare access, strengthen protections, and reduce systemic barriers. Social workers also play a critical role in promoting social justice, dignity, and access to resources. This story reminds us that immigration policy is not abstract. It shapes families, relationships, and futures. Supporting immigrant communities means advocating for equitable policies, reducing barriers, and recognizing the humanity behind every story, because every family deserves safety, stability, and the chance to live without fear.